I procrastinated. I didn't do anything for 2 weeks. Then I had 2 weeks before the exam. I said, all right, how can I tackle this? And I'm like, everyone says I should be an engineer because that's the way my brain thinks. What's the pain point? How can I solve it? And so the pain point was I had 2 weeks to prepare. I'm not going to do that big textbook. I'm going to do the little skinny study guide. And I'm like, okay, it's an open book exam. I can have my manuals and nothing else. So I started to read the study guide. And I'd say, I noticed that they were just basically discussing it by the grouping of the codes. I said, oh, these are the guidelines. So sometimes the guidelines were 3 or 4 pages before where the codes actually lived. And I'm like, I'm going to have multiple choice because in the study guide, they had practice questions and I could see how they did it. And I'm going to turn to where the codes are. I'm not even going to use the index. You're going to go to the codes on a multiple choice exam. And I'm like, okay, I got to compare and contrast and know the difference in their testing and guidelines. So I started to write the key words about the guidelines I read in the study guide in my manual. And this is how the BAT system was born. This was back in 1999. And I passed. And 2 weeks of preparing, just using the study guide and transferring those notes to my manual. And it made me realize how important it was to become one with your manual, like really understand it and feel super comfortable with it. Because a lot of times it's like a telephone book, right? You go to the index, you look up a code, you go turn to it, that's the number, done, shut it. But when you really start to see the flow of how it's arranged, it helps you to do that process of elimination. So at any rate, that's how it worked out for me. I realized coding was very important to billing.